Hi everyone, this is Neil Wright-Ater, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. It's a very interesting case. It's a revision earwax removal, and what I mean by that is that this patient actually saw another specialist prior to coming to myself, but they really struggled with this patient's ear, primarily because the entrance of this ear is extremely narrow. You can see the second bend there to the right. It's really protruding inwards, and I think the specialist did manage to get some of the more lateral wax out, but the patient actually reported the ears being slightly worse, and you'll see deeper in the ear some of the wax is impacted. Now I don't know whether that was done during the procedure or if the patient had used a Q-tip, but it's definitely been impacted. And because it is a narrow ear, so I totally understand where the other professional was coming from. So I thought I'd challenge myself and use the WAXscope, and I'm actually using our medium-sized specular here. Now, the reason for that is we have got a smaller specular, but the smaller specular is not going to dilate open this ear canal because that second bend is quite protruding and it's a bit deeper. So normally the specular doesn't enter the ear as deep as that. So even if I used the smaller specular, I wasn't going to be able to dilate open the ear anymore. So I therefore decided to persevere and continue with the size 2, which is our standard size, because naturally you're going to get more of a wider view. This wax is quite dark, it's impacted, and this is probably in the midsection of the ear canal, so I'm just going to refocus. It is matted, and when the matting is quite deep, it's another telltale sign that it has been impacted. So I'm just lifting it off the floor of the ear canal. And we just have to be patient with this and do this in layers. So I think I might go to the top bit here. So that's already in focus, I think. So that wax deepen, the center view, that's up against the eardrum, and that's why it's out of focus at the moment. Because, but when you have greater magnification, it's just physics. We can't overcome that issue, really. You have a shorter depth of field. So with an ENT operating microscope, so what ENT surgeons use for surgery, and also the WAXscope, because it's got such high magnification, when you remove a little bit of earwax and move on to the next section, you will have to refocus. When you've got low magnification, then the depth of focus is a bit wider and longer, but then you suffer from a lack of magnification, which you can't adjust. But with the focus you can. The only real instrument where you get both magnification and focus side by side is with an endoscope, and that's because the tip of the endoscope is actually located inside the ear, so the magnifying lens is inside the ear, so you don't need, in terms of the optics of the endoscope, a massive amount of magnification because it's already in the ear. So you're getting kind of more natural magnification, and therefore you're also getting a greater depth of field. There was some woolly hair, some woolly strands here. So again, another telltale sign that potentially this patient did poke in the ears. I did ask, but they said no. There's just some skin to the left, just peeling that, and then you got this centre bit, and this ear kept giving. I removed the wax, and I thought, okay, that's about it. And then I go back in, and lo and behold, there's more wax. So it's quite a generous ear. So again, just latching onto the wax. I'm just giving it a little wriggle because it is attached to that was attached to the front part of the ear canal, the anterior canal wall. And there's still more. So again, I'm just trying to stretch open the first bend as much as possible, but you're limited because that second bend is a bit deeper. Again, you got some kind of, it's a bit of dead skin, but also it appears that there might be some woolly strands there. Again, another telltale sign is patients put a tissue or cotton bud in the ear. So although it's a narrow ear, you see we've still got a really good view, we've got great magnification. And just coming back out, I'm going to stretch that first bend to the left, just want to straighten the ear a bit more. Got the wax in focus here. And I'm going to slowly bring it away. So I think that piece of wax enabled the full view of the patient's eardrum. Now, they have got this crusted, solidified wax and skin now on the canal wall, so I'm just going to clear this. Now, it won't necessarily improve their hearing, this, because the sound can now travel towards the patient's eardrum. There's a clear passage, but we just want to see if we can get some of this away So I would say this is on the posterior superior canal wall, which is the back top part of the ear canal. I've just focused initially a bit near the entrance, but then I'm just refocused to the deeper bit. And when I removed this section, quite a sizable piece came away actually, a bit more than I was expecting. And just by the colour of the wax, we know it's been there for a while. It's oxidised. Fresher secreted wax is more paler, more orangey browny, and then the darker wax gets more dark brown, almost pitch black in some cases. And there's just a little bit of wax now behind this second bend. This is a tricky section because I'm just getting the eardrum in focus to make sure that's all fine. This anterior canal wall, as I said, that second bend is a bit deeper than usual and it's a bit more protruding inwards. So I think I'm using the 17 gauge. I'm just going to glide across the canal wall. And we do manage to get the majority of this out actually. So that second bend, beyond that, the ear canal kind of goes back to the right. So this wax is almost tucked away, hidden, just refocusing slightly. So I think it's always good to upload some more challenging cases. I know when people watch, they want to see the whole view of the ear canal, that $1 million view, but the reality is cases like this where they've already had some treatment and is unsuccessful, I really enjoy those cases because it's you just kind of know it's going to be more technically challenging, and that's what kind of I enjoy doing, the really difficult cases. So I'm just mopping up a little bit here. Don't want to graze the canal wall. I'm happy with that. A bit of wax is not going to do anyone any harm. It's going to get the eardrum back in focus. I'm going to increase the brightness. I think I reduced it because it was getting a bit of glare and reflection because of the narrow ear. But really pleased with that. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.